We have Dr. Nash, and just before we get started, I want to stress that feel free to turn on your camera to engage in conversation. And we're gonna have some links that we're gonna send at the end of the session. One of them will be the quiz link, so keep an eye on that. And so I'm gonna get started by giving a bit of background about Dr. Nash, who is the founding Dean Emeritus and the Dr. Raymond C. Endorse and Grandon Professor of Health Policy at the Jefferson College of Population Health. And he is a board certified internist, repeatedly named on Modern Healthcare's list of most powerful persons in healthcare. His national activities cover a wide scope, and Dr. Nash's governance responsibilities for organization in the public and private sectors has served on the board of trustees for numerous healthcare systems. You can go ahead and get started, Dr. Nash. Thank you for coming in today.
Great. Well, great to be here. And thanks for having me. And thanks for everybody carving out the time. I really appreciate it. I think it's great that you have this kind of national organization. I wish this existed, 50 years ago. That would have been great to have something like this, and the technology. It's pretty awesome. Pretty awesome. So I'm at your disposal, Taryn. Would you like me to talk a little bit about my current role, or what are your preferences? I'm also happy just to take questions too, because I know everybody's had a busy day and they want to get back to their studying. So this is a study break for people. Wish I could see some more of them. There's all kinds of great cartoons and so on, but I'd like to see everybody's smiling face. Give me energy.
If you're okay with it, give a little bit of background about yourself and basically what you do. And if anyone has any questions, feel free to turn on your mic or drop them in the chat.
Okay, great. Uh, maybe some of you know about Jefferson Medical School in Philadelphia. It's coming up on its 200th birthday in 2024. And it's one of the largest private medical schools in America. So it's not like Texas sized, but almost. So there are 285 students in each of the 4 classes, 4 years. So it's over 1,000 medical students. I went to the University of Rochester. In Rochester, New York, we had 90 kids in each class, and it was the largest class in history in Rochester. So, Jefferson is gigantic. But my story was, so I grew up on the South Shore of Long Island, New York. I went off to college at Vassar College. And for you guys, that doesn't mean much, but Vassar was an all-girls school for over a century and a half. It was one of the 7 sisters, and it went co-ed, and I was in the 2nd coeducational class. So when I showed up to the campus in Poughkeepsie, New York in 1973, it was 70% female and 30% male. So I learned right away that with all due respect, girls are way smarter than boys. And I learned that immediately in organic chemistry and calculus. Oh my God, it was unbelievable. So after Vassar, back in those days, there was no such thing as a gap year. If you got accepted to medical school, you went because you were afraid they'd give your spot away. So I went from Poughkeepsie, New York to Rochester, New York for medical school. Rochester, in the way medical schools are sort of organized across the country, Rochester is a heavy-duty, research-oriented, sort of a top 10 medical school from NIH dollars. And I was very, very fortunate to get admitted there. I went directly from medical school to residency, internship and residency in Philadelphia at one of the University of Pennsylvania hospitals. I got married in medical school to another medical student. So you guys, you don't know what might happen even on this Zoom call. So you better be careful. I went to a medical student convention. You can't make this up. In New York City at Mount Sinai Medical Center. And at that convention, I sat next to a wonderful girl from Brown Medical School. 1 year later, we were engaged, and a year after that, we were married. Unbelievable. So we moved to Philadelphia together. She had finished Brown Medical School. I finished Rochester. So we were at the very beginning of a major national trend, which is doctors marrying doctors. So for all the ladies here, 70% of female doctors marry other doctors, 70%. And that makes a lot of sense, and especially now that there are more women than men in medical schools. But this was a long time ago, so this was the very beginning of that trend. So we went to one of the Penn Medical School hospitals called the Graduate Hospital in South Philadelphia. We had an amazing training experience. My first 2 months as an intern in 1981 coincided with the first cases of AIDS in America, in New York, in Chicago, in Los Angeles, and Philadelphia. So the COVID is my second pandemic, basically, if you look at it that way. So I finished residency, 3-year internal medicine residency. It was pretty awesome. And then I had the real privilege. I went to the University of Pennsylvania campus, and I was in a special program that doesn't really exist in its same format today, called the Robert Wood Johnson Foundation Clinical Scholars Program. Details not important, but it was a special 2-year post-residency program where you could go to business school and they would pay for it. And the goal of this program was to create a national group of physician faculty leaders for the future. And that's exactly what that program did. So after I finished the Wharton Business School program, so I did college, medical school, residency, then 2 years of business school. So I told my children, who are now all grown, that I went to grade 29. You get the idea. And after business school, through this special fellowship program, I then joined the faculty at the University of Pennsylvania in the Department of Medicine. I stayed there for almost 5 years. And then I moved across the city from West Philadelphia, where Penn is, to the middle of downtown Philadelphia, where Jefferson is. And I started at Jefferson in January of 1990, a little over 31 years ago almost. And I've been at Jefferson the entire time on the faculty in several different roles, which we could talk about. But I think the take-home message is your generation is totally different. I would highly recommend, if you have the opportunity to take a gap year, that you take it. If you have the opportunity to take a year out and do research or work in an underserved area or travel overseas, learn about things outside of medicine, great idea. 40 years ago, we didn't have that opportunity. There was no internet, there was no cell phone, there was no way to connect with people like you have. So if you have that opportunity, it's really fantastic. I should also tell you that I majored in economics at Vassar, and I'm a huge believer in non-science majors going to medical school. That's not to say it's bad to be a science major, but when you get to medical school, you'll have more science than you ever thought you needed. So it's a good opportunity to study anything but that in undergraduate school. But I'm not going to hold it against you, but I am a strong believer in trying to broaden your understanding of where the world is. And the world needs more English majors going to medical school, more econ majors, more psych majors, anything but biology and chemistry. And you'll get all the biology and chemistry that you need, hopefully, when you go to medical school. So let me stop there. I'm happy to talk about what I did at Jefferson in the last 30 years, but I think the two take-home early messages are, take a year off if you have the opportunity. That's really great. And if you've already decided on your major, that's okay. But I strongly urge people to do something non-science if they have the opportunity. The challenge of doing non-science is you still have to do all the pre-med requirements, as you guys are experts in that. And so I would run from organic chemistry lab to a advanced microeconomics course. We had a handful of econ majors who were also pre-med, so we kind of hung out together because nobody could understand how hard we were all working, like you guys work so hard. And if you're a liberal arts major, you know that that's very different from being pre-med. And that hasn't changed, I don't think, in 40 years. So it's an important opportunity in undergraduate school to do stuff you wouldn't otherwise have the opportunity to do, because once you get into medical school, there's sort of no looking back. And unfortunately, there aren't opportunities for a lot of non-science exploration. So that's how I got to Jefferson. Why don't we stop there, Tara, and see if there are questions, then we can come back to the kinds of work I've been involved in at Jefferson, which is a little bit more timely for sure.
Yeah, sure. There's a few questions in the chat if you want me to read them out.
Let's see, I can make the technology work here. Cool. Okay,
Go ahead.
here we go. Wow, these are good questions. You guys are smart. How do you balance social parts of your life with medical schools? Yeah, well, that's a really great question. So I was really a bad student in medical school because I had been an econ major, and Rochester attracted all kinds of people who already had master's degree in biochemistry, a master's degree in microbiology. So I had a lot of catching up to do. It took almost the entire first year of medical school for me to figure it out. And my advice on how to achieve balance is just pass year one and year two. I don't ever care, and I never looked at anybody's grades in the first 2 years of medical school. It's like high school, but worse. So I never said to anybody, oh, wow, how come you didn't get, a high grade in whatever it is, biochemistry or physiology? So I think one of the ways you balance is you have to have a different worldview than when you're in college, and it's all about just learning for the sake of understanding it and learning it instead of just trying to get a good grade. So my advice about year one and year two is just pass. What's way more important is what you do in year three and year four. And I know that a lot of different schools have different curriculum now, but basically preclinical versus clinical, I don't really care what anybody does in preclinical as long as they, understand the material and pass. So that's one way you achieve balance. And also, I think, you guys are smart, good study habits, being well organized. I'm very, very happy to tell you that I never once stayed up all night studying, never once. Not as an undergraduate, not as a medical student. The only time I stayed up all night is when I was an intern or a resident. Because what good is that? You're so exhausted the next day, you have no idea what end is up. So another way to balance is go to sleep early, exercise. I mean, you know all this, but it's really important, really important. Have a hobby and make sure you're eating okay. I mean, it's really important basic stuff, but it's huge. And so many people study at all hours. I could never do that. So I was always pretty boring, got my homework done, tried to go to sleep at a decent hour, tried to work out, and tried to not lose it when everybody else was losing it. That's also another important part. And you guys have a big burden called social media. We didn't have that. So I also recommend detoxifying from social media. What do you care what everybody else is studying or how many hours or whatever? Forget about it, or what they got on the exam. So I know from talking with medical students over 30 years that there's all kinds of stuff going on all the time on social media. So another way to achieve balance is to forget all that stuff and just focus on yourself and your friends. And you don't need to worry about what anybody else is doing and how many hours they've studied or what's in the lab that they're doing. I mean, that would drive me crazy. So sticking to what's important. Okay. So then the more difficult questions. Do you know anything about chief nursing officers? Do they have any advice? I wish I could give you better advice about chief nursing officers. I know that I've known about 10 of them in my career at Jefferson, and they have all kinds of backgrounds. I think the more important question that we could chat about is what makes a good leader? I mean, that's kind of the basic question. A lot of people think that putting physician and leadership together is a difficult concept. I've been all about training physician leaders. That's been my work for 30 years at Jefferson. And lots of people, even to this day, they wonder what's a physician leader? So all doctors have a leadership job one way or another because we're allocating precious resources. We represent the largest component of the 1% of the population in terms of income. The public pays for your internship and residency through Medicare. So you're a steward of resources that are precious and getting more precious by the moment. If we don't do something, Medicare is going to be bankrupt in 2024. That'll mean you guys are going to be in trouble if that happens. So all doctors are leaders. So I think the real question is not necessarily, specific advice for aspiring chief nursing officers. The real question is giving good advice to aspiring leaders. So what does that mean? Well, leadership is a really important role. There's a whole literature, there's huge courses, there's an incredible amount of material online to learn about what leadership is. It's different from management. Leadership's about inspiring people. Leadership is about having aspirational goals that you help other people to understand. Leadership is getting out of the way of people who are helping you and let them excel while you are in the background. Leadership is creating a goal that people could rally around. It's all those things. Leadership is persevering when people don't believe in what you're talking about. Leadership is using data to convince people of your position. It's all those things. And unfortunately, medical school doesn't teach a damn thing about leadership. So one of the challenges is if all doctors are leaders, but medical school doesn't teach it, that's a problem. So maybe not for tonight, but as you progress in your careers, thinking about, well, what kind of medical school do you want to go to? And is it one that believes in leadership and has leadership training? Is it one that believes in social justice and has public health and population health courses? Is it one that recognizes that there's terrible structural racism in our country and is going to do something about it? Is it one that recognizes that we got underrepresented minorities or a huge minority in medical school still? That medical school is too damn expensive. So if you want a school that kind of understands all that, well, that's great. Not every school does. Good news is you have a lot more choices than I had. There's about 140 medical schools or more. They've doubled in 30 years. So you have a lot more choices. So that's something to think about. I know it's hard to think about where you are now, but I mean, these are important questions. So I think the idea that you have an organization like this and get to talk to people is really fantastic. Okay, let me check another question here. You guys hard questions. Okay, what drew you to an MBA as well as an MD? Okay, that's a great question. So I don't believe that all doctors need to go to business school. That's not the case. And I certainly don't believe that everyone in business school should go to medical school. Yikes, that'd be bad. But what I do think is if you have aspirations to lead, and let's say you want to run a hospital or run an insurance company or run a group practice or any kind of leadership role, here is something that's very important, which is little early for you guys, but if you want a leadership role, you're going to have to get a degree in addition to the MD. So let me let that hang in the air for a moment. So tonight may not be the right time to talk about getting 2 degrees, but because most medical schools don't teach the leadership piece, you have time, lots of time to decide this. But I decided really early on that I wanted to be a physician leader, and that's what attracted me to the Robert Wood Johnson program and the Wharton Business School. It doesn't have to be that. There are scores of business school programs for doctors today that didn't exist 40 years ago, so you'll have lots of opportunity. But I think for tonight, the main thing to think about is as you get into medical school and think about the future, you have to really do something very difficult, which is self-evaluation. You got to look in the mirror. You have to understand what you really like to do. Are you a people person? Do you want to be in a laboratory? Do you like a team? Do you like to be by yourself? I mean, these are really, really important questions that, again, most advisors don't ask. Most pre-med committees have no idea. Most folks who write letters for you have no idea. So you got to be your own advocate and you have to figure this out. That's another piece of advice I would say in terms of not only balance in your life, but don't rely on the pre-med advisors. Don't rely on the committee. Don't rely on the people who are writing you letters. I could tell you pretty much hands down, most of them have no idea what they're doing. It's pretty sad. And in really big schools, double what I just said. So you got to be responsible. You're a grown up, you'll figure it out. You got to make sure that you're getting the right information. You have all the information in the world at your fingertips. Use it and go and ask people like me and hundreds of others and get good advice. So another message for tonight is don't rely on one pre-med committee in one school to give you all the answers. Not possible. And the answers that they probably give you, a lot of them are not correct anyway. So how does it aid being a practicing physician? So here's the connection. Healthcare is the biggest business in America. It's almost 20% of the GDP. It's $10,000 per person, including children, every year. So in 2020, we spent even more than that because of COVID. So there's no other industry that comes close. So it just makes sense that having a business degree helps you to manage the biggest business in our country. The second reflection is good medicine done right, which you will learn about, without waste and without error, that's good business. So understanding how they're all connected, that's something you get, unfortunately, not mostly in medical school today, but mostly in business school. So again, I don't recommend it for everybody, but if you have leadership aspirations, it's definitely a great idea. Okay, let me tackle another one. How is dealing with AIDS compared to COVID-19? Wow, that's a great question. So we didn't know what in August of 1981, I know it seems like the Civil War to you guys, but trust me, it was like yesterday for me. In August of 1981, it wasn't called AIDS. It didn't have a proper name, and we did not know about the virus, and it wasn't called HIV, and we didn't know how it spread. And there was huge prejudice, just like there is today. And I remember taking care of some young gay men who were dying, and they had a new kind of pneumonia that I had never heard about in medical school. Of course, pneumocystis carinii pneumonia. I had never seen a case of it in my life. So they were dying of a terrible, some kind of cancer on their skin, Kaposi sarcoma. I had never seen a case of that in medical school either. So it feels a lot like today. I mean, we didn't know about how COVID was spread. We didn't understand the long haulers. We don't understand who gets intubated and who doesn't. We don't know why some people are totally asymptomatic and other people go from sitting, breathing to getting intubated and in an ICU in hours. So it's the same fear, the same unknown, the same anxiety. The big difference, as of course we came to learn, is that HIV is, you got to have immediate direct contact with body fluids, and it's prolonged. And we didn't know any of that in 1981, but shortly thereafter, 82 and 83. And by the way, it was also Dr. Fauci in 1981, 2, and 3 who was writing all the papers about AIDS. And here we are at age 80, and he is still at it. In fact, I have a special guest I want you to meet. So say hi to Dr. Fauci. He's joining us tonight. Hi, all of you guys. Looking forward to seeing you, future colleagues. And he's pretty awesome. So he's next to me every day, giving me good advice. Okay, very good, Anthony. See you later. So the similarities, I think, were all about the unknown and the prejudice, the fear, all the crazy wrong decisions that we made. We gave people drugs that didn't help. We didn't know how to treat pneumocystis carinii. We had no idea. We didn't even know what it was. And it took years, of course, years. Still no vaccine for AIDS, of course, but great drugs. And it's basically treatable today, even by primary care doctors, which is amazing when you think about it. Remember, when you read medical history, it was called the gay plague. I mean, I don't think that would work too well in 2021. That would not be what we would call it, but that's exactly what it was called. And it was huge prejudice against all gay men mostly, and terrible, terrible behavior. Even at our hospital, I can remember nurses and some doctors who, thought that, quote, they deserved it. So, have we come all that far? I don't know. Kind of a sad question to think about. But those were some of the similarities and differences. I think key difference, of course, is getting the vaccine in record time due to amazing technology. There was no internet, no ability to share data. So without that internet, we would never have a vaccine. Think about that. Because immediately you could share the genome. In 1981, we had not yet described the human genome. PCR testing did not exist. CRISPR did not exist. So it was like, compared to today, the dark ages in terms of doing research. It was totally try this, let's see what happens. So we had no idea. So I think we have much better science today. But of course, it was nowhere near the number of deaths. I mean, this is a staggering, staggering situation, especially for our country, and in the developing world. Well, it's even a bigger, bigger problem. But more on that. Okay, let's see. So we'll do one more and then we'll switch gears here. So MPH or MBA, which holds more value? That's a great, great question. Here's the surprising answer. It doesn't matter. Sort of if you said to me, okay, I see Cameron and Rachel and Jacqueline and Christy, and if they all said, oh, I want to go to Wall Street and I want to be a physician advisor to companies, well, then I would say, okay, MBA. But if you're not sure where you want to go, but you have leadership aspiration, then MPH, MBA doesn't matter. What matters is being a doctor first, and then getting these other skills and attributes and letters after your name. I've advised medical students, probably I've been the mentor for 30 years times 30, almost 1,000 medical students. I mean, that's staggering when you think about it. And I tell them the same thing, that they have to look in the mirror and think about what they like to do every day, and what turns them on, what they find boring, what gives them energy, what saps their energy. And then once you go through that kind of difficult process, it becomes a lot clearer what type of additional training might be useful. And that's a hard thing to do. You're not ready for that now, mostly. But in medical school, it's a good time to sort of say, okay, what am I enjoying? What am I not? And why? And that'll help you to make that decision. Another take home, I think, if I might, Taryn, is go find a good mentor. that goes for everybody on the call here tonight. If you don't have one already, well, okay, I get it, but you got to go find a good mentor. Now, for the women, it's a little harder. There are not enough female faculty, but still doable. And you don't have to have a female mentor if you're a woman, but it sure helps. But any mentor at this moment would probably be great, as long as somebody who knows you and can give you feedback and you can establish a good relationship with, who's not afraid to tell you that you need to think more clearly, you need to take more time, you need to be more self-evaluative, and who can open doors for you and help you to connect with people. Mentors are really a major, major important thing. And having a great mentor will really ease the journey, even in college, certainly in medical school, if you're lucky enough to have one. Um, Let me close this section. I'll tell you a great mentorship story. It's a little corny, so just hang in there for a moment. So when I was in high school in 1973, that's a really long time ago, I thought I wanted to go to medical school eventually, was thinking about which college and where I could be pre-med, et cetera, just like you are. And I read a New York Times article about a guy at Penn Medical School who was, get this, in 1973, he was created a program to train physician leaders. So I looked at this article and I thought, wow, that is really pretty cool. So of course, no internet. So I typed him a letter. I sent this guy a letter. It's a big shot at Penn Medical School. I was in high school. I wrote him a letter, and that son of a bitch called me at my parents' house at home. And he said, anybody who writes me a letter like that, I need to meet you. Get on a train and come to Philadelphia. I told you I lived on Long Island. I had never taken a train by myself from Philadelphia to, from Long Island to Philadelphia. So I got on a train and I went to meet Sam Martin. I was 17 and a half years old. And he was a Titan, major, famous guy. He was also really tall, 6'4", had a deep Missouri accent, and he already had been the dean of 2 medical schools. And he became my mentor from 1973 until he passed away in the early 1990s. And I would write to him and meet with him. Having somebody like that, precious. And if you could find somebody who could help you, that's the greatest gift you could do. And he made us promise that we would be mentors in the future. So here I am tonight. So Taryn, that's the story up to Jefferson. What else do you want to get into? These are great questions everybody's asking. I think we hit almost every one of them. Here's one. How do you organize, plan, and prioritize your work? Oh God, yeah, that's a great one. So let me recommend a couple of books. The 7 Habits of Highly Effective People, fantastic book. Earlier you read that, the better. That's a great, great book. And then there are other books on, The True North. That's a great book too, about what do you care about? What are your goals? But the 7 Habits, the earlier you read that, the better. It's really pretty straightforward, and it's a lot of common sense. Make a list, do it today, not tomorrow. Don't postpone. Don't be distracted. Set aside time to unwind. I mean, all good habits. I still make a list. I mean, here's my list for today. I mean, so I've been carrying a file card in my pocket every day for 40 years. And it feels really good if you're a list maker to, cross that thing off your list. So that really helps me. People make fun of me in the office that I still have a file card. That's old fashioned. You guys have a phone, so you can put your list on your phone. But being organized, I think that's the main message. And, there are 4 truths, right? You're familiar with the 4 truths. So truth 1 is don't take it personally. Truth 2 is speak the truth, mean don't fib, tell it like it is. Truth 3 is, yeah, don't take it personally, speak the truth. Assume nothing. Very hard to do. Very hard to do. And um, these are really important things to try to internalize. And the fourth truth, I think, for your generation is stop paying attention to everybody else. You're only responsible for you. And all that intense, TikTok, FaceTime, Instagram. Oh my God. I just think that stuff is certainly has its place, but it could also make you crazy. And I wouldn't believe 3/4 of what your friends are putting up there anyway. And you will see when people start the interview process for medical school. I know that there's terrible competition and people are, what school did you go to? What did they ask? Don't do any of that. So those truths of, you know, be self-reflective, speak your own truth, assume nothing, don't take it personally. Those are really important, and they're hard to live by. But a mentor can help you with those truths. So that's also pretty important. If you're lucky enough to have parents who get it, well, that's a blessing. Not everybody is. But if you have a mentor, especially somebody in the business who can help, I mean, that's a great thing. Okay, Taryn, so we did a lot of great questions. What do you want to talk about next?
I actually have a question for you, Dr. Nash.
Okay, there you go.
So I'm actually a finance student and planning to pursue an MD MBA.
Wow.
So would you like give any advice on based on like the admission process? Because I've heard like a lot that you just have to show like you're passionate about like the MBA part, but mostly like the medicine part. But
Mhm.
like, is there like anything more specific like I should focus on, like such as like gaining like finance like experience in like the healthcare like
Yeah.
system?
So let's talk about that. Let me broaden the question a little bit. I know that currently a lot of medical schools, including Jefferson, look for, clinical stuff that you've done, shadowing or, clinical research. I think that's crazy. What I would look for is uh, in what I would call, and some schools call, evidence of an enduring commitment. Let's do that again. Evidence of an enduring commitment. So that doesn't mean that you joined every club to buff your resume, and you never forgot to send a Mother's Day card. That's not what we're talking about. What we're talking about is you have a passion for something, and I don't care what it is, but you've exerted that passion and you have followed that passion and you have been selfless and you've helped others by following that passion. I don't care if it's, helping the homeless, feeding the hungry, doing research, all of that is fine. But as long as you have evidence of an enduring commitment that you've done something that you care a lot about and you followed through, and you did it not to attract attention, but you did it because it showed your level of commitment and you love doing it. That's what I think is important. So all these advisors who say, do this rotation or shadow this doctor or volunteer in that hospital, well, okay, but I would really urge that you have a plan and that you have some uh, idea of, well, what do you really like to do and how can you demonstrate your passion for A, B, and C to a admissions committee. So let me give you a concrete example. I think great being a finance major, that's awesome. So, what I would say is, how can you leverage those skills to improve this broken system since we spend more money than any other country on the planet? I mean, that is how I would approach it. And what books do you read about changing the system? And who have you spoken to? And what ideas do you have about how you could fix things for the future? You don't have to be an expert, but who have you talked to? What books have you read? What's the evidence that you're able to, connect the dots, so to speak, and show people in a coherent conversation where you're not on your phone, that you can write a cohesive 2 paragraphs that describe who you are and what you are. Um, Let me give you another kind of take home. Whenever I meet with young people, and I get to do this a lot, almost, and especially pre-pandemic every day, I would always say, so what's your elevator speech? And you got to deliver it to me in 20 seconds, because that's all you're going to ever have on an elevator. So what I usually say in the hospital setting to young people, a little bit older than you guys, but young people still, I say, if you're in the elevator with the president of our 14 hospital healthcare system, and he says to you, hey, uh, Cameron, how you doing? And what's your aspirational goal? You better be able to deliver it in 20 seconds. And I mean, like, rehearse it. That's a great, great opportunity. Now, you don't necessarily have to do that exactly now, but it'd be great practice. And I mean, like, in the mirror practice, so that if anybody says to you in authority, or who can open a door, or who's offering their help, and they say, well, what are you interested in? You ought to be able to deliver in 20 seconds a coherent message about who you are and what you care about. Um, that's really important. I know it sounds incredibly corny, and some people are probably wondering, who is this guy? He's lost his mind. But trust me, I've been in the business of training leaders for 30 years. And this is an enduring message that is still really important today. Maybe even more so today, because you are all so distracted. You can't help it. I get it. So focusing and practicing what's your message, you would call it what's your brand, that's fine. But I think practicing that message, what do you want to do? Not, what do you want to be when you grow up, but what do you care about? It's a different question. And if some leader says to you, Priya, what do you want to do 5 years from now? It'd be great if you had that pinned down. Now, it doesn't have to be exactly right, but so what? Go through the exercise of, well, what do I want to do? And what do I enjoy, and what gives me pleasure and what gives me pain. That is a hard thing. So I think I answered your question, Taryn, but maybe not exactly what you wanted to hear. And once again, I wouldn't pay too much attention to what you hear from, who said this and who said that. I think most admissions committees, they're looking for, enduring commitment. Are you articulate about your goals? And, do you have the grades? So that leads me to this question. Which year of undergrad would you recommend to start preparing for the MCAT? Wow, I don't know the answer to that. Maybe we should crowdsource that. I don't know the answer. When do you start preparing for the MCAT? I would say, every time you take a course, you're preparing for the MCAT. The most important thing for these ridiculous standardized tests, as you guys know, is to get practice tests that are all out there and available, and you have to pay for them, but some kind of practice test, because they generally speaking follow the same format, and the MCATs have changed so many times I've lost track. But every course you take is additive towards, getting a good score on the MCAT. So to me, it's, when do you start preparing? First day of college. I mean, really. And take good notes so you could go back to it and review, and do the practice tests until you recognize the question. And then what are some tips to get into a good medical school? So let's talk about what that even means. So that's an interesting question. What's a good medical school? I don't know the answer to that. I can tell you my prejudice. It sort of depends on what you're interested in. There are some medical schools where, let me give you a good example. So Geisinger Commonwealth School of Medicine, many of you probably never heard of it, in Scranton, Pennsylvania. Well, Scranton's famous now, but Geisinger is a medical school that has the largest number of students who are the first kids in their family to ever go to college, let alone medical school. That's a very different kind of cat than Yale Medical School or Duke or Harvard or Rochester or Northwestern or Vanderbilt. I mean, that's a totally different kind of cat. So what kind of cat are you? So a good medical school, I don't really know what that means. It depends on what you want to do with your life. It is true. If you said to me, okay, Dominique wants to be a medical school dean as her aspirational career goal, well, then it probably matters where you go to medical school. Other than that, probably doesn't matter worth a damn. The hard part is not getting in. The hard part is doing a good job when you're there, just like college. I mean, you could go to any college and it's all about what you do when you're there and the decisions that you make. It's not so much the getting in. That's the easy part. It's the resilience and taking advantage of all the opportunity and all of that. So to me, it's a good medical school. I mean, I think I get that, but it totally depends on what you're interested in. There are a bunch of new medical schools, of course, that didn't exist until very recently that are totally rad in every way. Kaiser Permanente has a new medical school called the Bernard Tyson School of Medicine, and they are all about social justice. So, if you want to go to Wall Street, I probably would not go to the Bernard Tyson School of Medicine. And there's a University of Houston, not too far from you guys. I mean, that's a school all about serving the poor. So if you're not into serving the poor, you probably don't want to go to the University of Houston. If you want to be a research scientist, I wouldn't go to Geisinger and I wouldn't go to University of Houston. I would go to a research medical school. So if you have really good grades and choices, those are some of the measures, but generally speaking, it's what you make of it. I think that's the most important thing. Great. So what are some skill sets you acquired during training? So during medical training, let's see, Ruth, help me out here. What are some skill sets you acquired during training? Undergraduate training or medical school training? So she needs to help me understand that question. Okay, so why don't we talk about Jefferson and then give Ruth a chance to help me understand her good question.
Hey,
So
Dr.
I've
Nasher,
been,
I
yes,
apologize for interrupting, but I just want to say that our Linktree link is in the chat, and also the quiz link for this session is also in the chat. I apologize
okay,
for interrupting,
that's
Dr.
right.
Nat.
Teach me what's Linktree? What does that mean?
Oh, like Linktree is basically like a website where you could put like all the links that like you want to associate, and
Ah,
you could compile them all in like one link.
oh, cool. Okay, I
Yeah.
didn't know what that was. Um, so just quickly looking at the hour here. So it's very unusual for anybody to be in one campus for 30 years. You're not going to do that. Trust me, I'm a dinosaur in that regard. But I've been very lucky to be at a place where I could have different jobs over a long period of time. So my most recent role at Jefferson is I was the founding dean of our College of Population Health, so the first such school of its kind in the country. And we combined public health with health economics, finance, healthcare quality, and health policy. And we put all of that, so public health, finance, quality, we put all of that in one big place, and we put a roof on it, and the roof is called population health. So my last job, most recently, was being the dean of that school. And it was designed from the ground up to be virtual. So we opened that school in 2009, a little over 11 years ago now. And we attracted mid-career students from all over the world, really, but mostly domestic. And these are mid-career people, a lot of doctors, but not exclusively, nurses, pharmacists, who were interested in uh, changing and growing on the job and getting more leadership responsibility and helping to fix the broken system. So for 10 years as dean, we helped to build this school, and now there's 15 or so other colleges of population health. So this was my last big job at Jefferson. Now I'm emeritus dean, but I'm on an endowed chair. So that's a nice thing to get if you can get it. It's somebody sends the school a lot of money, names a chair after their family, and part of my salary comes from this endowed chair, which is great. So I have a lot of autonomy to work on things I care about. And now I'm teaching and doing research and writing papers and working on some projects and helping a bunch of companies, including some in Texas, um, who are involved in remote patient monitoring and health information technology and biotech and a generic drug company and all the things that touch on the ecosystem that is 20% of the GDP. So it's been a great ride to be at a place which has been, good to me. Well, this is a great question. What's your advice on paying off large amounts of student loans? God, yes. That's a really great question for which I have no good answer. I mean, unfortunately. What a lot of students do, unfortunately, is turn into super subspecialists, go into lucrative fields to try to pay off the loan. But no matter what you do in medicine, you will make a good living. So I would not be too worried about that, quite frankly. I know that sounds maybe cavalier, but I know I'm right. You do what you love, and the loan will magically take care of itself. For people who feel so compelled that they want to be a super duper subspecialist and have a technology that no one else can do, the dilemma with that is about 10 years into doing that technology, they're totally burnt out and they feel that they're just a technician. And that's sad. So I know it's hard, but I honestly, the loans you will find a way. You'll always have an opportunity as a doctor. There's all kinds of amazing things to do. So I'm really not worried about that. I know it sounds difficult, but that's the truth. What's your favorite project that you've worked on? Yeah, Suhas, great question. Yeah, well, I guess my favorite project was building the school. That was a 10-year effort and training and nurturing the people who really did all the hard work. I was just basically the cheerleader. But among my projects that I really cared about are building our master's degree in healthcare quality and safety, training a lot of future chief medical officers, editing a journal that helped to define the field. I'm the editor of the best-selling textbook in the world on healthcare quality. There's 4 editors. We each take turns being the editor-in-chief. The book's in its 5th edition, and it's used all over the world. So that's an amazing thing to be connected to something like that. So I know that my work has reached lots and lots of people. That's very gratifying. So that would be my best answer. So you guys are great. I wish you a lot of luck in the journey. Great that you have an organization like this where you could meet one another and cry on each other's shoulder and get advice from each other. I think that's good. So let's sort of summarize maybe some of the take-home messages if we could, in no particular order. I think one is do that self-evaluation so you know who you are and what you like to do and what gives you energy and what drains you. Find a mentor, practice that elevator speech, and most importantly is, take good care of yourself so that you're at your best all the time, and that will show. And get off social media and care more about yourself than everybody else. I think that's obviously, I know it's corny, but probably pretty damn important. And it's so easy to get totally preoccupied with what you think everybody's doing, and they're all fibbing anyway. So I would just focus on what's important. And of course, the 4 truths: do your best, always speak the truth, don't take it personally, and assume nothing. And those are really hard to do, but really, really important. Well, thanks again for inviting me, Suhas. I hope everybody is has time to go back and do their thing tonight. Great to meet all of you. And I learned a lot. And now I learned what tell me that thing again. Where is it? Linktree. Okay, cool. I didn't know what that was. And
Thank you, Dr. Nash.
hope this is of value.
Yes, I think you have a very unique perspective on medicine and business. I think a combination of what you've done in the past was kind of unique. So it was good hearing from you.
Great. Okay. All right. Well, good luck, everybody. Stay safe, and I hope you get vaccinated too. That's really damn important. Yeah. So should have said that at the outset. So as soon as it's available, whichever one it is, go and get it, for God's sakes, and tell your parents and your friends too. Otherwise, we're never going to get out of this jam. That's probably the most important damn thing we could do tonight. Okay, got to sign off. You guys have a great night. Thanks again for having me. Bye-bye now.
Thank you.